name's Bridget Finley, and this week for my project I'd like to talk about regional interdependence as it relates to neurodynamic tension for the upper extremity or your upper limb tension test. I'd like to talk about how I use this clinically during my exam, most commonly, and how I can use it as a test, retest, as well as give you a couple of clinical pearls of how to do the test, and then an intervention to see if I can change the symptoms and retest at the end. So most commonly in the clinic, I will use this to rule out or rule in a cervical radiculopathy. So we know with our clinical prediction rule that the first thing I'm going to look for with my patient is a loss of cervical range of motion. So turn your head to the right. So if she's got less than 60 degrees rotation, that's one of my positive tests. The next thing I'm going to look for is a positive Sperling's test. So I'm going to bring her back and rotate her down and give a little compression. And I'm looking for that reproduction of the arm pain. The next thing I'm going to look for is go ahead and lay down. Is a traction test, distraction test. And if I can give a little bit of cervical traction, and again I'm looking for an improvement in her arm pain or symptoms. And then finally, the last test I'll do is my upper arm tension test. Now, a couple of clinical pearls with this test is you want to have the patient lay down. You want this part of their arm supported. Wainer et al. Talks about depression of the scapula. And when you do this, you want to hold the shoulder down, but you don't want to put so much stretch that you already traction the nerve, because when you do that, you'll get some false positive tests. So you want to stabilize scapula, bring the arm up into abduction, supination, wrist extension. First, you'll externally rotate, and then you'll begin to extend the elbow. And right through here, you'll get some positive tests. And if she's got a radiculopathy, let's say this is where she reports her symptoms come on. And it should be the same symptoms that are in her arm. And I always ask patients, are those your symptoms? Am I reproducing your pain? Because this test can be a little bit tender and painful on a lot of people. So once I find her pain, I will show you a technique to go in and see if I can't make some changes on that neural tension. So go ahead and sit up for me. Since I'm really trying to target the cervical thoracic junction, I'm going to do a seated CT manip. And to do this one, I'll have her grab around her neck. I'm going to grab over her hands, and I'm going to just have her lean back and give a little manipulation to the upper cervical spine. And then go ahead and lay back one more time. And I'll retest this. And the nice thing with this, a couple of things happen, is if I can quickly make a change in her pain and symptoms, people really buy into what we're doing. And then they really get how we need to treat the neck even though they've got pain in the arm. So I'll use this as a retest to come back and quickly see if I've made some changes. And if you can get about a 10, 15 degree difference in that, I consider that a positive for my intervention making a difference with her pain.